Hello, welcome. My name is Tracy Ellig. I'm the Vice President of Communications for Montana State University. And welcome to today's Back to School panel for the upcoming fall semester. Joining me today are going to be a number of panelists. I'm going to list them today and then we'll introduce them again as they come up and speak. But today we will have Sam Mitchell, the Chief Medical Officer of the University Health Partners, which provides the Student Health Clinic here on campus. Beth Burroughs, Head of the Department of Mathematical Sciences, which is going to talk about what it's like to have a classroom experience this fall. Jeff Bondy, Director of Residence Life, who's going to talk about what it's going to be like to live on campus this fall. Matt Caires, our Dean of Students, who's going to remind us how important it is that we all work as a community this fall. And finally, Betsy Asserson, our Director of Counseling and Psychological Services, who will be talking about tools students, faculty, staff, and parents can use to help themselves get through this difficult time. Since we announced this event last week, we've received many questions about what the campus experience will look like this fall. While we won't be able to answer all of those questions, we have combined them into our panelist presentations and are aiming to address the vast majority of the questions that we've received through those presentations. I'd also like to direct our audience to MSU's homepage. Now on our homepage, if you scroll down just a little bit, you will see our COVID link. That link contains an enormous amount of information about the fall, and it also includes a link that allows you to submit a question to the university so that we can get back to you and answer your questions. Again, you can find that on the MSU homepage, which is a comprehensive clearinghouse of all our information on this fall semester as it relates to COVID. One other thing, in addition to our guests, we have a silent guest today that I'd like to introduce, which is our Clean Cat Kit. This is a kit that will be distributed to every single student who comes to campus this fall. This kit contains a hand sanitizer, a surface disinfectant, a mask, and 3 washable cloths with which to wipe down surfaces. These kits are going to be available at tents around campus, August 17th through 19th, and students will need to show a valid CAT card in order to receive their kit. And then students living in the residence halls will find these kits already in their rooms when they arrive. Now, we really want you to use these kits, especially the mask. As you'll see, all of us are wearing masks today. You're going to see lots of masks. We hope you use that, as well as the hand sanitizer and the spritzer. And each one of us is going to give you a little demonstration before we speak about how we want these used, and we would love to see students using them as they come into every class. So you'll have these kits, and each time you come into a new classroom, and before you sit down, just do a little spritz here, give it a sec, and then wipe down your surface. You can do this with door handles, with computer keyboards, with class desks, the whole thing. So we hope you will take advantage of these kits and use them every single day. Now I'd like to introduce our first speaker, Dr. Sam Mitchell, the Chief Medical Officer for University Health Partners.
Thank you, Tracy. Well, we are excited to have you coming back, and we realize that it's a fall unlike any other in the history of the university, or for all of us, frankly. This is a very new scenario. I want to try to highlight some things that I think are going to be very important for us to have a successful semester and year. And in particular, make sure I'm working on the clicker here. Let's see. Okay. So what I'd like to start with is talking about what I think are the three most important actions that we can take as individuals to try to limit the spread of COVID until there is really successful treatment and ideally a vaccine. I'm very hopeful from what national leaders are saying that both of those, treatments and vaccines, will be available later this fall for the treatments and vaccines beginning in early 2021. But until we get there, it's really behavioral approaches that are going to help us keep COVID at a very low level and allow us to move forward as a university and a society. Those three things you've heard of, I'm certain. Wear masks or face coverings, practice social distancing of 6 feet or more whenever possible, and good hand washing. And I want to talk about each of those, why it's so important. The masks are important because COVID is a respiratory virus, and it's spread as we talk. If I weren't wearing a mask and you were to shine a light from the side, you would see little drops as I'm speaking. We try not to spit on each other, but the fact is, at a microscopic level, we have little droplets coming out of our mouths when we speak loudly, certainly when we sing or yell. So masks really prevent the droplets from traveling very far at all, and they probably reduce larger droplets by 80 to 90%. There's another form of spread, which are called aerosols, and aerosols are finer particles, smaller than, I think, 0.5 microns, 5 microns actually, and they waft around in the air for a longer period. I think the best analogy for what an aerosol is if you walk into a house and you smell cookies baking, chocolate chip cookies, one of my favorites, but you're nowhere near the kitchen, that's an aerosol. The aroma is being spread around as an aerosol. And as you can imagine, that's really wafting around in the air for quite a long time. Similar to cigarette smoke is another thing that's not so pleasant to smell. And when we wear masks, we reduce the spread of both droplets and aerosols quite significantly. Initially, it was felt that masks were really just to protect other people if we were infected and didn't know it, or if we were infected and did know it and were coughing. But there's increasing evidence that masking, cloth masks, face coverings, all of those things can really help protect us from acquiring the virus if it's floating around in the air. So you're doing the altruistic thing to wear your mask to protect others, and you're also practicing common sense to protect yourself when you wear a mask. Social distancing is also very important, and that's because the larger droplets, certainly those between about 5 and 50 microns, are affected by gravity pretty quickly. The largest ones will drop within seconds towards our feet. The smaller ones take longer but have a downward trajectory. If we're spaced 6 feet apart, then the droplets tend to drop well before they make it close to our face. And so social distancing is a second method that's very, very important for minimizing spread of infection from somebody who doesn't know they have it or passing somebody who does have it and is trying to make their way to a hospital or another medical facility. The last thing I'm going to mention on that is good hand washing. And the reasons behind that are that coronaviruses are what are called enveloped viruses. They have a core of their RNA genetic material and some proteins, but wrapped around that they have a fatty layer, a lipid layer. And lipid layers, just like any other oil, can be disrupted by warm water and soap. Even cold water and soap is better than no water and soap. So what you want to do is, as I think we've all learned this past year, try to wash your hands vigorously with warm water and soap for about 20 seconds, the typical time it takes to sing happy birthday to yourself. If you want to annoy your roommate, you could sing that aloud, but I'd prefer that you try to keep that to yourself. If you don't have access, though, to a basin and soap, then the Clean Cat kits have in them a hand sanitizer, and I won't take this out of the bag because it's Tracy's bag, but these hand sanitizers are full of alcohol-based or I think an quaternary ammonium base. I don't remember the exact one that we're using for this fall, but we're going to have refill stations spread throughout the campus, and so we encourage you to use it frequently. Really cover your hands with it, work it in, and then let them air dry. If you run low, there will be stations throughout the campus for you to fill them over and over. So if we can do those three things, we think we can really limit the spread of COVID sufficiently that there will be sporadic, small outbreaks which are controllable by identifying them with testing and then helping our public health officials do contact tracing to limit the spread into larger and larger groups. It's really, really important. I do want to emphasize that MSU has a mask policy in place, which is quite similar to our county policy and the state policy. But on MSU grounds, we want you to wear masks at all times if you're inside. And the one exception to that is if you're sharing a dorm with your roommate. The two of you are considered basically a household, or if you're a family in residence life, you're considered a household and you can take off masks then. But other than that, we really want to encourage mask use in the hallways as you're walking up and down, to use the bathroom in a dorm, as you're walking between buildings or between classrooms in a building. And I would recommend it, frankly, outside as you walk from class to class, unless it's 5 in the morning and you're out for a jog on your own and there's no one else around. In that setting where, air movement is diffusing vapors, aerosols, droplets very quickly, you don't need to wear a mask. But if you start to notice, well, I'm running up towards a group of people, I'd slow down and put your mask on, because that's really important that we protect each other. I ran over from clinic today, and although I wasn't seeing patients, in our clinic we all have to wear surgical masks as well as patients coming in. And rather than discard it, because these are actually hard to come by, I just decided to wear it for the rest of the afternoon. But what I would recommend is always carry backups. And I have a good cloth mask in one pocket and another one in the other pocket, because masks break or they tear or the string breaks and they fall off or they saturate with water because we're breathing heavily as we walk quickly across campus. And if they get uncomfortable, rather than taking them off and removing that protective thing, we want you to take it off and put on your backup masks. So my encouragement is to come to campus with, if you can, 4 or 5 masks. Our Clean Cat kits will add to that supply for you as well. Another critically important thing that we're all having to get used to is really paying close attention to signs and directions, particularly in new locations. So if you're a new student to campus, try to take a close look at signs as you go into buildings. There's been a big group on campus that spent a lot of time looking at pedestrian traffic flow and trying to figure out optimal ways for people to enter a facility, get to the classroom, get to their seats, come out of the classroom, leave the facility. What we're trying to do as much as possible is prevent a lot of direct face-to-face contact. That way, if it's all in one direction, if I were to cough and it were to get past my mask, it would hit you in the back of your backpack or the back of your hood, and we think the risk of infection is extremely low from that. On the other hand, if people just ignore those and crowd into entranceways or exitways and they're standing face-to-face, there is a much higher risk of potential exposure there. So as you get used to coming into the buildings, try to figure out what the signage tells you. Does it tell me to go right here, left here? How do I move forward? That's going to be really important for maximizing our ability to keep space, adequate social distancing, and reduce the risk. Few other things I want to highlight along this level is personal behavior. On campus, we've got a lot of signage, we've got a lot of reminders. In the dorms, the RAs are going to be helping remind people, these are important things to do, and we hope that everyone follows this guidance. But we recognize that people are not only on campus, they're out having fun with their friends, they're going back to see their friends and family at home, and what we want to encourage you is try to keep up that good behavior when you're at home. Because if you do all the best behavior in the world while you're here, and then as soon as you get home or out with friends, you take off your masks and you're sitting elbow to elbow with 10 people packed into a car, that really breaks down the whole point of this. So it's a behavioral change we're all having to come to grips with, that we need to follow these guidelines, hopefully not for much longer than a year until vaccines are available, but I don't think we can guarantee that, and right now it's really the only things we can do. And a very important thing we want to get into people's minds, and I'm doing this myself, as are all my family members, are try to self-monitor every morning when you sit up in bed. Don't even leave your room before you do that. If you can get an electronic oral thermometer, we definitely encourage you to do so. If you're running a fever higher than 100.4 Fahrenheit or 38 Celsius, that's a fever that we need to know about, and we don't want you to leave your room until you call your medical provider, which is us, University Health Partners. If you're a student seeing us, if you've got a private provider already in the community or elsewhere, you're welcome to call them. But please don't leave your room and go to the dining hall or go to class if you have a fever. Similarly, there's a group of other symptoms that are pretty suggestive of COVID. The strongest ones are cough, congestion, sore throat, But there are some others like diarrhea, even nausea, vomiting, generalized body aches, and chills. The CDC has an excellent self-checker program that you can pull up quite easily at the website directed there. I think it's in everyone's information. Or just go to Google and say CDC self-checker, and it'll bring you right there. And you can run through that pretty quickly, and it will tell you, yes, you're okay to go, or no, you really ought to contact a health professional and get this sorted out. But if you'll run through those things every morning as you sit up in bed, take your temperature, that should be a great habit to get into that helps you be safe for the rest of the day. I want to turn to an area that's pretty contentious, and there's lots of different ideas about how to approach, and there's a lot of questions about it as well. And that is testing for COVID. There's really two big areas of testing. One is diagnostic testing, which is where we're trying to test for somebody who's actively infected, who has symptoms or has been a very close contact of somebody we know has COVID. Surveillance is another approach where you're taking people either in random groups or subgroups, like an entire dorm or a building, and you surveil everyone in there. You test everyone in there periodically. Well, here's the challenge. CDC has looked at the data and said that if we were to test everyone as they return to campus, which some campuses are doing, the problem with it is that it's a snapshot for those few days where you're actually testing, and after that, it becomes very quickly useless data, because 2 days after you were tested, you could be exposed and you're just as vulnerable as if you had been tested. And there's not enough tests to do it, quite frankly. In the United States, last fall, there were 20 million entering students into the university system across the United States. Currently in the US, we can run about 750,000 to 800,000 tests per day. So if even a quarter of those students were to return on campus and all be tested, we would be using up a week's worth of national testing capacity, and that's not allowing for testing of anyone else, nursing homes, ICU patients, ER visits, etc. So there frankly just aren't enough tests to do that. So we are working with our epidemiologists, Dr. Raina Plowright here at MSU and Dr. Sophia Newcomer over at the University of Montana, looking at different modeling approaches and focusing most of our efforts on diagnostic testing, because that's where we think we get the most utility from our tests. We have some testing called point-of-care testing in the clinic itself. We have local testing sites, such as drive-through testing sites run by our local hospital system, the Bozeman Health and Deaconess Hospital, and they even have a viral triage clinic as well as testing in the urgent cares. So we will help work with students who feel that they are ill to figure out, how do we get you tested? And then after that, the next question, what happens if I test positive, or a friend of mine tests positive, or a roommate tests positive? What we do is we isolate people if we know that they're positive. And with COVID, the average or the upper length of time for people to shed virus, other than very rare situations, I'll talk about those in a little bit, but other than rare situations, it's really 9 to 10 days. And so the CDC guidance and many international organizations in other countries are saying, if somebody is positive or they develop symptoms and then they're tested positive somewhere in the next few days, from the time they either test positive and they're asymptomatic, or they get symptoms and then they're tested positive, from that time forward, 10 days is where they need to be isolated. Towards the end of that period, the last day, the last 24 hours, you need to not have a fever at all, and so we'd encourage frequent temperature checking, and your symptoms need to be improving if you were a symptomatic case. So if I developed a cough and a fever and I was tested, I'd have to go for 10 days, and on that last 24 hours, my cough definitely needs to be lighter. It doesn't need to be entirely gone, but it needs to be improving. And we will be working with students, as will the County Public Health, to check in and say, what are your symptoms like? Are you getting better? Are you getting worse? When do we think that you can come out of isolation? If the question moving on from that is, what happens if a person in the residency halls tests positive? Well, we've worked really hard with residence life and housing to figure out some quarantine and isolation apartments. And those are ways to move people out of a crowded dormitory situation where they might have to walk down the hall to use the bathroom, to instead be in a situation where they have a room that has a private entrance, they have their own kitchen, their own bathroom, their own bedroom, and isolate them there. We're working out and have worked out this spring when we had cases in them, how to bring material to them, books, computers, private goods. We have meal delivery figured out for them, and we have good ways to support them if they feel like they're getting worse. Sort of related to that is, what happens if public health says you're a close contact? And that can be challenging. Let's say that you didn't think you were at any risk, and you took off your mask and you sat for an hour studying elbow to elbow with your friend or watching a show, and then your friend gets sick and your friend gets tested and they say, yep, you've got COVID. County Public Health will be reaching out to all the positive cases to say, who were you around, and in what kind of settings were you around, and how long were you around them? They protect the privacy of the individual who's sick. They don't identify them to the contacts, but they call the contacts then, and they email them or find other ways to reach out to them. And they say, we believe you have been a close contact to a COVID case. Do you have any symptoms? If so, you get tested immediately. If not, and you're a close contact, then you're asked to quarantine for 14 days. Because even though an active case of COVID may only run for 10 days, if I'm exposed, I could become ill at any time for the next 14 days. And so we have to do quarantine. And those will be done in similar units. We're not going to double up people who are actively infected in isolation with people who are in quarantine. We want to keep them separate. But we would help them work with faculty and staff to keep up on their classes, to check in daily on symptoms, if they became symptomatic, to test them, and to provide additional assistance if they were becoming more ill. Final thing I do want to touch on is what might trigger a return to fewer in-person classes or online-only classes from a health perspective. Many, many people have asked, what's the number? If we have 10 cases or 50 cases or 100 cases on campus or in Bozeman or in Gallatin County, does that trigger us to shut everything down to online only? MSU will go on. We'll still have courses going on, but if there's a decision that the spread is just too rapid, then we might have to revert to online-only classes. We won't be closed, but we would be online. And so the calculus that goes into that is really coming from the county and state public health offices. What they're saying is, if we have 50 relatively healthy young adults in isolation on the MSU campus, and few, if any, of them require any hospitalization or support, that does not at all press or stress our hospital, our ICU, and our ability to provide health care. We can handle that. That's a totally different situation if we were to have an outbreak, say, in a nursing home. If we had 50 elderly individuals with lots of comorbidities suddenly infected, we could quickly swamp the hospital and the ICU system, or at least fill it to a point that all of us would be getting pretty uncomfortable that we have additional capacity left. So it depends where cases are occurring and with what rate. And that would be a really complicated calculation to figure out, but our county feels like they've got a good handle on it, and we work very closely with them to say, are cases still manageable, or are they getting to a point we need to back down and slow down? And we might slow down a dorm for 14 days if we had a lot of cases in one dorm, or one building where we had a lot of cases. We would do deep cleaning through the custodial services, but we might take that building offline for a week. So there's ways we can maneuver around it, but the best thing is to not get in that situation. And I feel like if we can really support each other, and we can remember to do those important things like wearing our masks as much as possible everywhere that it's needed, try to maintain that 6 feet of social distance, and do frequent hand washing, we can manage getting through COVID till there truly is a cure and or a vaccine. Thanks for coming this fall.
You just leave that there.
Oh, do you want me to spray it down?
Yep,
okay.
Thank you. All right, thank you, Dr. Mitchell. And so Dr. Mitchell was up here. His paws were all over this podium, so I'm going to clean it for our next speaker, which is exactly what we want you to do when you go into a classroom, just like this. I feel sort of like Mr. Rogers right now, except I don't have my sweater vest. So I will take, before we go on to Dr. Burroughs, there's one thing that Dr. Mitchell brought up that I want to elaborate on a little bit, which is he used the phrase, the county feels they have a good handle on it. And I want to make sure that that's not misconstrued, that the county has a number regarding MSU that it's got tucked into a desk drawer. What Dr. Mitchell means is that the county has a very good handle on what's going on in terms of bed capacity at the hospital, in terms of the type of cases that we're seeing, and also in terms of what information they're gathering from their close contact contacts. So that's what's meant by the county has a good handle on it. What it really means is the county has its ears to the ground to be very sensitive to changes in all these different dynamics. And just quickly, Dr. Mitchell, did I get that right?
Yeah, I think that's very accurate. They're weighing lots and lots of factors into those decisions.
Okay, thank you. Now I'd like to introduce Dr. Beth Burroughs, head of the Department of Mechanical Mathematical Sciences, who's going to talk about your experience in the classroom. And Dr. Burroughs, I have a fabulously clean podium for you.
Thank you for cleaning that off, Tracy. Thank you for the introduction. So what I'll talk with you today about is what you can expect in terms of classrooms and instruction when you're here on campus. So there are some phrases that you'll hear. So how will classes be delivered? We will have some classes that are face-to-face. And face-to-face instruction happens when the classroom is large enough. So when there's enough room for everyone to be spaced out, then you could have a face-to-face class. There will also be what you'll hear is blended classes. And so blended classes are when students are doing some work online and some of the work together in the classroom, and I'll talk more about that. And then we also will have some online classes. So online classes are of two types. Synchronous is what we call it when everyone logs on to the class at the same time. And asynchronous is where students log on once a day, but the time of day doesn't matter. So what will the classroom experience be like then? If you're in a face-to-face experience or the face-to-face component of a blended class, students will all be sitting at least 6 feet apart. And sitting 6 feet apart is how we keep that distance that Dr. Mitchell talked to us about in terms of just being far enough away that the spread is, the risk from spread is reduced. So how will you know how to sit 6 feet apart? There will be chairs that have stickers on them that say, "Don't sit here." So that's where you don't sit. Just like there will be signs about which doors to come in, there will be signs on the desks telling you where you should sit and where you shouldn't sit. When you come in, if you want to spray down your personal area, use your Clean Cat kit, that's something that you're able to do. You take that personal responsibility, you wipe down your personal space, and then you have a clean desk that you're sitting at. Also, everyone will be wearing a mask. There will be face coverings everywhere. So the mask will cover your nose and your mouth, and that's just reducing that spread the way Dr. Mitchell described for us. Now, there are some classrooms, labs, and studios that have other types of protective gear that's specific to whatever activity you're doing. And so instructors will have guidance for you about what safety equipment is required, how it should be used, and how you should move about in that lab and studio space. So one of the ways we're making sure that we have enough space is we're using some new classroom spaces that we haven't used as classrooms before, like the ballroom here in the sub. There's plenty of room for students to spread out. The Schroyer gym, same thing. It will have desks and it will be used as a classroom space. I want to say a little more about blended instruction. So In blended instruction, students will have a substantial face-to-face experience, and they will engage with content and with each other online. And so, for example, if you have a class that's scheduled on Tuesday and Thursday, and it's listed as a blended class, then it could be that half of the students come on Tuesday and they engage in the classroom with the instructor on a Tuesday, and the other half are doing some work online. And then on Thursday, the students who were there Tuesday are doing their work online, and the other half of the students get their face-to-face component. And so how you will know whether you should be online or face-to-face, you'll get messages from your instructor. Those will come, they'll be posted on your Brightspace page. You'll get used to using Brightspace as our course management system, but they'll also come to you as emails as well. So just being proactive about communication is something that faculty are doing, but students who have questions, you can email and ask your instructor as well. So as I describe that, there's really a lot of effort that we're going through to make sure that students have a classroom experience on campus. And why is that? It's because there is a social component to learning. We are human beings, and it's how we construct knowledge, by communicating and socializing with each other. And so that's really what we're looking at, is preserving that social construction of knowledge in your experience this fall. So when you're in a blended class, what are some of the things you might do when you're in class? So you might participate in a discussion. Everyone's wearing their masks, and you're discussing things with the help of the instructor. You might be watching a student presentation. You might be working on problems by yourself or in a small group, even though you're far apart from your classmates, and then you'll be discussing your answers with your instructor. You might just be asking questions of your instructor in sort of an open question and answer period. You might be taking notes in a lecture, and lectures are very often interactive, and so there's a stop and a pause and an asking, and so that might happen when you're in a classroom together. And then you might be taking a test or a quiz or some other way to make sure you're gauging what you're understanding and your instructor can understand as well. So then what happens in the online component? Well, you might be watching video lectures or demonstrations that are made by subject area experts. And sometimes those experts will be your instructor or a collaborator of your instructor. It might be a textbook author. It might be a national expert. And so we're making use of a lot of resources to get you that sort of video content that is often part of the online component of a blended class. You might be watching a student presentation, or you might be making a presentation while you're online. You might participate in a discussion by posting in discussion groups. And so Brightspace, that I mentioned before, that's our course management system, has a nice feature of being able to post responses and be thoughtful by posting discussion posts with each other. And that's something you'll get used to as well. Again, you might be working on problems on your own, like what you might usually think of as doing homework, but that could be done as part of the online component. And then you're preparing your ideas to bring those to class when you have an in-class component. You might be reading articles or textbook materials. You might be taking notes on a lecture, on one of those video lectures I described. And maybe you're taking a test or a quiz online. So as I talk about taking a test or a quiz online, I really want to talk about the ethics of learning in a community. And it's important to emphasize that you're here at the university transitioning from being a student to becoming a professional. That's really what your 4 years at the university are for. And so we're going to hold you, and you're going to hold yourself accountable to professional standards. So we're there to help you with it, but I really want you to think about yourself as someone who's an emerging professional in these 4 years that you're here. So when I think of the ways that I collaborate with others in my profession, if I've looked something up, I write it down, I cite it so that others know where my ideas came from. So if you look things up in a book, you should cite that. If you look things up online on a web page, you should cite that so it's clear where your ideas are coming from. If you're working in a group and you're working with somebody, you can cite your group as well. And so if you're not sure when you're thinking about assignments, if it should be with open notes or an open book or being able to talk to group mates, ask your instructor. We're here to help you. What we're really counting on and supporting you in is developing your professional and personal integrity. And so think about that. And I hope you'll join us and take that component of your learning seriously as well. I'll say a little bit about the preparation that faculty have been doing over this summer as well. Boy, we learned a lot during the spring, and we really had time to consider how we can rely on online resources in supporting our teaching. The university has the Center for Faculty Excellence that has been hosting workshops all summer for instructors to attend and really figure out how to make use of the different resources that we have available to improve the online components, but also the in-class components of our instruction. And then lots of our national and subject area associations have been holding workshops throughout the summer as well. So it's really given us a lot of time to prepare that I know everyone felt caught off guard back in March. So we're at the point that if we have to switch online for one of these temporary adjustments, we're ready. But I know that students have learned a lot as well, and so I want you to think about how much you've learned about scheduling your time when you're working independently, and bring that to the university with you. One of the most difficult things for many students when they leave high school and come to the university is figuring out how to manage their own personal time schedule. And you have a head start on that because there was a whole lot that happened this spring that kept you independent. So bring those skills with you. Now, some frequently asked questions we've been seeing. So what do I do if I get sick? So first of all, contact your medical professional just the way Dr. Mitchell described to us. Make sure you take care of your health first. And then reach out when it is practical. Reach out to your instructor and let them know that you're ill. You don't have to give details. You shouldn't say anything that's personal information, but just let them know that you're seeking treatment and you're under the care or getting advice from a medical professional. And so then when you're ready to come back, do you need a doctor's note? No, you do not need a doctor's note. Faculty won't ask them for you. You don't have to make an appointment thinking that it's because you need to get a note. Just being clear in your communication with your faculty is important. I think recognizing that it's a shared responsibility between the student and the instructor to make a plan to make sure that the student has the right kind of guidance to get caught up when they're ready to be back working in class. So I talked about the different modes that classes will happen in, face-to-face or online or blended. So how do you know how your classes will run? For that, you can look in My Info. So that's one way to look up your schedule, and you can see course notes to see the mode that the class will run in. But you'll also be getting information from your instructor. So keep an eye on your MSU email and also look on your Brightspace pages in the few days before classes start. And that's how you'll know what to do in those first few days of class. That's how you'll learn about your instructor's plans, about if you're in a blended class, maybe you should come on Monday or should you come on Wednesday. You'll get information from your instructor about when it is that you should come to class. So I'm really glad that you're going to be learning alongside us this fall. When I think about what education is for, it's really developing expertise. And now more than ever is a time where we need more expertise in this world. And so thank you for coming and developing your expertise alongside us.
Thank you so much, Beth. We really appreciate that. That was great. I'm going to go through my little ritual here and clean down these things for our next speaker. And while I'm doing that, I'm just going to cover a few things again that Beth talked about, which is, it's a shared responsibility. And so if you're a student and you feel sick, your responsibility is to go see the doctor and also let your faculty member know. And as Beth said, you don't need a doctor's note, and you don't have to tell your faculty member that you're going in for COVID, you don't need to tell your faculty member that you've tested positive for COVID in that case. You just need to tell them, you know, I have a medical issue, I'm going to miss class, and I need some help on keeping up with class during this time. So we've talked a lot about that amongst the faculty, so they're ready for that to happen, but we need students to carry their side of that equation as well. So the next speaker is going to be Jeff Bondy, Director of Residence Life, who's going to talk about living on campus this fall.
Thank you, Tracy, and good afternoon, everybody. We're excited to meet you in just a few short days and welcome you back to campus or welcome you to campus. Living on campus is an important part of the Bobcat experience, and it's an important part of our student success plan. As a member of the on-campus community, not only are you live close to your classrooms, you're also, there's a lot of convenience associated with living on campus. You don't have to prepare your own meals, you don't have to do your dishes, but probably most important is you become part of a community that is there to support you and to get to know you and share the common experience. And yesterday we had a great day. We opened Highlight Hall, which has been under construction for the last 2 years. And if you haven't seen that, there's a link off the university's webpage, and you can get a glimpse inside of that hall. It's wonderful. Maybe the nicest residence hall I've ever seen. Not all of our halls are as new and nice as Highlight, but they would argue they have a strong sense of community. And one of the things that's as nice about every hall is the support that you're going to get and the spirit and the pride that goes along with that. A week ago, we welcomed back our resident advisors, about 110 of them. And every time I'm around this group of colleagues here, I feel very good and confident that we have put together the best plans, and we spent a lot of time doing that. And I'm here representing my staff as I cite my source, Beth. I work with some really smart people, and all of our plans require the cooperation and require us to work as a community, as neighbors and as citizens together, because we value this experience. And I tell you, I have been very impressed, humbled, and just prideful as I look at how our students, the RAs, some of our student athletes are here. We have some of our Hillman scholars, and I see students wearing masks and spacing out and going on walks with one another. And there's just a really positive spirit as we begin this year. I asked the RAs, I was on a meeting with them just before leaving, I said, I'm about ready to talk to many of your associates and friends and students from across the country and from across the world. What should I tell them? What will it take to continue the spirit? And these are the words they shared with me: tenacity, resiliency, support, communication. They mentioned community and the importance of listening and being flexible and just being there for one another. And I quoted she's one of my favorites, Abigail. I'm not going to say her last name today because I single her out all the time. I said, how are you feeling about us approaching the semester? She's one of our leaders. She's an assistant resident director. She says, Jeff, I would rather be with my friends and my community wearing a mask rather than being at home. And she says, we're going to get through this. And it might be a little different this fall than it was from last fall. And so today I want to talk a little bit about some of those differences. Also, when we were together yesterday for the grand opening of Highlight, and as we were together as a community, I felt this sense of optimism and hope because, yeah, we might be wearing masks when we can't socially distance, but there's a lot of things we can do. I saw groups of people together safely, building new relationships, catching up, and they were so happy to be together. And there was also the common factor of they're appreciative to be back home on campus. And so, again, it was a great week. As we prepare to develop community this year, it is going to be a little different. Students we're dedicated to the personal development and developing meaningful and intentional connections with our residents. We're just going to do it a little differently. And another skill and quality the RAs mentioned was creativity. They're talking about karaoke contests outside their residence hall windows, back and forth to the neighboring residence hall. They're talking about going on hikes and finding places to get together. I asked the group today for ideas, and Matthew Magoon says, hey, let's get some canopies and let's spread them out around Highlight and North Hedges and Roski. I think those would be great places for students to spend time. I'm like, we can do that. And he says, and maybe we ought to get some extension cords and bring them out outside where we can plug in our laptops and study. And I said, well, we'll get some of those too. But that resiliency and that community spirit and the can-do attitude that we're seeing, I can't wait for you to join the group of students who are here. I'm very happy to be a part of that community. Okay, in and amongst that, we also acknowledge the uncertainty that students may be feeling due to COVID-19 and the changes of their daily life. With guidance from Sam and others and the county and state officials with the commissioner's office, we're doing everything we can to help mitigate the risk of transmission. We're going to be as safe as we can, and we're going to work hard at that. And importantly, here's some things to consider as we welcome you back. Students will be required to wear face coverings that cover their nose and mouth in all interior public spaces, including the residence halls. When you're walking to the bathroom, we would like you to wear a mask. We're going to ask you to wear a mask. And when you're in the bathroom, we're going to have some spacing, and we're going to have some toilets and some sinks offline if we don't feel like we have the adequate social distancing or physical distancing there in that space. Only students assigned to a specific residence hall will be allowed to enter the building. No guests will be allowed in any of the residence halls during fall semester, during the beginning of fall semester. Now, I'll admit this has generated some concern, and I've had some really good conversations with students and parents because they wanted to know why. We're going to continue to evaluate this policy as we move through the semester. To begin with, we want to make sure that we evaluate how people settle in. Importantly, we want to pull our floor and hall communities together and have a community conversation about how we can promote safety in the residence halls as a community. I want to know how everybody feels about that before I make a decision to change. But again, we're going to evaluate that with input from all of you when you return. Thank you for understanding that. Access to our buildings is going to be limited to a single point. As a reminder, all of our desks are staffed 24 hours a day. We're very fortunate to have that. And we're going to ask that students come in so we can help monitor traffic in and out of our residence halls. We're going to need your help with that as well to provide some community accountability. Our custodial and cleaning services, we're going to follow the CDC guidelines, and we've always followed a rigorous cleaning schedule. We've invested about $100,000 in new equipment, and we have, I think they'll arrive later this week, some electrostatic misters that we're going to take throughout our spaces into the evenings. Our custodial staff, some of our most important community members who have done some heroic work this summer getting everything ready, they've agreed to adjust their schedule. Some of them will come in as early as 5:30 in the morning to get through some of their other duties, and then some of them will stay as late as 7:30 at night so that we can provide an additional disinfection and cleaning to the restrooms and shower areas, and they're going to be continuously cleaning our high-touch services. Each one of our residence halls is going to have clean kit refilling stations. Please, let's clean those refilling stations out. That means you're using it. That's great news for us. We've got a good stock on hand, and we're thankful to have those. Each student's going to get one of these RHA. The Residence Hall Association, our student government, has purchased a cloth mask for every student. I think you're going to get 2 masks when you move, and we would encourage you to bring several of those. These are really nice. I'm a lot better looking with this mask on. Thank you, Tracy. Let's see here. I'm going to talk a little bit more about our cleaning. We have weekend student custodians that we moved to that model about 10 years ago. They clean the bathrooms and our common areas over the weekends, and importantly, they're going to clean into the evenings as well. We've basically doubled our staff, and we may have some positions open if you're looking for a job. You get room and board, and then we ask that you, as part of that community, work to keep it clean. So we've doubled up our staff there. Our shared areas, laundry facilities, elevators, and meeting rooms, and frequently touched surfaces will be cleaned and disinfected, utilizing EPA-registered disinfectants multiple times per day. Shared bathrooms and living areas will be cleaned and disinfected twice per day. Beth, that's per Chancey Ringer, who oversees that program with Tim Hansen and Todd Ruterdale. Okay. Let's see. I think I've covered the rest of it. The clean kits, cat kits we've talked about. Very thankful to have those. We're going to have hand sanitizer everywhere. We'll encourage you to bring some as well. Also, when we talk about quarantine and isolation, our protocol, those words, it took me a while to learn the difference between the two. And they sounded a little scary when we first started talking about it. We've had some practice with our quarantine and isolation space. We feel like we have a really good space for that with exterior entrances, and we have some good control. We've also got RAs and RDs assigned to that area should we utilize that, because we don't want you to feel isolated, or I don't know what it would feel like to be quarantined, but we want to make sure that you're connected to resources. In addition to the medical resources, we want to make sure that if you need a snack or something else, that we have someone there checking in on you, and that you can continue to be a part of this student experience. Would encourage you to always pack lightly. As proud as I am of Highlight and all of our facilities, you know, there's no sense in bringing two of one thing. So pack lightly. You can always purchase things when you get here. And also bring, we would call it an emergency bag. This is a best practice where if you should go into quarantine, you know, make sure you've got, you know, I don't know who has 14 pairs of anything, but now would be a time to think about it. We also have laundry services, and we've got a plan for that, but it might be your favorite snacks or your books. When you get here, if you were asked to move into isolation or quarantine, what would you need to take with you? And we'll talk more about that when you arrive. The furniture in our public spaces, we're going to spread it out so that you can, you know, Highlight Hall was great to be in yesterday because it was intentionally built to connect students, but also we can safely spread out and, you know, talk to one another from a distance and study in those spaces. So, but we're going to go through and audit that continuously to make sure that we feel good about that. Lounges and meeting rooms that cannot accommodate social distancing, we're going to take offline to begin with. Our exercise rooms will be offline because we're going to use the University Central Fitness Center. We feel like they have a better, you know, they can dedicate more time to keeping that area clean. Let's see, what else? Residents, this is important too. I think this is a great opportunity. We always encourage residents to fill out roommate agreements with their roommate. We've added some questions that address how can we keep one another safe? How can we communicate? How can we be resilient and vigilant and tenacious as we get through this semester? And what are we going to do, you know, and just to talk about that. And I'm telling you, our approach this year is all about neighboring and citizenship and working as a community. We love doing that. We get to do it with in a new context. And again, I think the group that's here is up for the challenge to facilitate that discussion. Let's see here. The last part of this I would leave you with, Tracy mentioned, and I think maybe Sam and Beth did as well, we're in this together. There's a sense of spirit here as we open Highlight. It was just an opportunity to get together with friends that almost felt like family. We had people, you know, alumni there and people that were just interested in what is this experience like. I remember what it was like when I was an RA in Coulter in 1972. I remember my room in South Hedges in 1989. And don't you dare tell any one of them that Highlight's going to be any better. Okay, but they're connected to this experience through the traditions and that energy that was very evident yesterday. And that's how we're going to approach this semester on campus. We're going to have community councils for each hall where we're going to pull together, not necessarily as an enforcement group, as a vigilante group on whatever. It's going to be, how are we doing? What can we do more? Could we educate more? Can we have some considerations? Do we need to talk to this group of students more? But it's going to be RAs and students and leaders and desk clerks and custodians, because that's what we're all about. Community working together, resiliency, and I can't wait to meet y'all, and I think that's in a few days. So, Tracy, I tried not to make too much of a mess here. Thank you.
Thank you so much, Jeff. You hardly touched this, but I'm going to clean it anyways because that's what we do. And also, while I'm doing this, I'm just going to talk about a few things Jeff mentioned, which is one, he said that there would be refill stations in the residence halls, and there will. There will be stations where students can refill these little bottles. They have a little twist top. But more importantly, there's going to be more than 80 refill stations all across campus. So even if you live off campus, it's going to be very easy to refill not only this surface disinfectant, but also hand sanitizer. And in fact, those are up now. When we walk around campus, I see those all over the place. And so that's for everyone. Before I introduce Matt Caires, the Dean of Students, there's a few things I want to talk about. I'm going to connect some dots here, but I also want to talk about one issue that we've got a lot of questions about, and that has to do with tuition. So the question has come, if the university were to go fully online, would there be a tuition discount? And before I answer that, I want to put this in context, which is tuition is a decision that belongs to the university system's governing body, which is the Montana Board of Regents. The Montana Board of Regents has looked at the issue of tuition, and what they've recognized is that all the campuses of the Montana University system, of which MSU is one, have fixed costs. We still have to pay our faculty, we still have to pay our staff, whether we're teaching face-to-face or whether we're teaching online. Those fixed costs are quite substantial. Additionally, we have fixed costs in order to maintain buildings as well as make bond payments on buildings. For that reason, the Board of Regents at this time is not contemplating a tuition discount should the university go fully online. But what I would say is that we are making all of our plans and have implemented them, and we're ready for a face-to-face fall semester. And I can't emphasize enough that Dr. Burroughs really brought this out, that there's a social component to learning. And that's why we're doing this. If you have been at home and have been staying away, but you've had an opportunity to have a socially distanced meeting, you know there's such a difference. It's even 6 feet apart, even wearing masks, there's a huge difference. You feel a different energy, and you are able to read people and learn things from people in ways that you just simply can't do online. That's why we think it's important to have this in-person experience this fall, and we're prepared to do it. We've taken all these steps to reduce risk, and also, as Dr. Mitchell has pointed out, we've really been thinking through how to make adjustments, to be very nimble to make adjustments. So it may be unlikely that we would ever reach such a bright line where suddenly the whole campus would be online. What's more likely is that there'll be a step-by-step process where we make adjustments through the fall to continue online with, we could have we could have a class that might have to quarantine, or we might find that we need to disperse the class a little bit more. We can do all these things. And we know we can do them. We know we can do them because this spring, we woke up one day as a university and as a nation, and something unprecedented happened, which was the COVID pandemic. No one in Montana higher education had thought through what that would be like. And yet, we had the resilience and the energy and the ingenuity to adapt very rapidly. And that's what we did this spring. And we're confident that we can do it again this fall based upon changing circumstances. So that being said, I would like to introduce a real friend of students here on campus, Matt Caires, our Dean of Students.
Thank you, Tracy, and thanks to all my colleagues on stage. Today is a really great day. Today, as we gear up for this semester, I'm reminded I'm about ready to start my 23rd year working on a college campus. And I have to admit, every time I start a new school year, it's the best time of year. College campuses are a funny place, especially during the summer when there's not a lot of people around. Here in Bozeman, there are actually a lot of people in town during the summer. Now, most of those people are visitors, guests, tourists. but most of our students are gone. And this summer has been no different. The campus has been quiet, but I can already start to feel it. Our students are starting to come back. Our faculty are returning to campus, and the energy is building. And this year, even though it will be different with the COVID virus, that energy is present, and it is a great time to be at Montana State University. We've heard today, and we know there is inherent risk with opening campus for a face-to-face experience with the COVID virus. One of the things I want to make sure that you understand is that we're committed to being on campus to offer this face-to-face experience, and we are going to be sharing that risk with you. You've heard us today talking a lot about the protocols and the procedures we have in place to reduce that risk. But the common theme you'll hear today, as well as this fall semester, is we're in this together, and that we need your help, our students, to make sure that we come through this fall, to make sure that we can continue to offer a face-to-face experience, and to make sure that we have the safety of our students, our faculty, and our staff on campus, so that we can continue to do what we do best. We know, we've heard from our students, what happened last spring when we went online, even though it was still a quality experience, many of our students told us they wanted to come back to school in Bozeman this fall. And I've watched in the last 10 years, as I've served as the Dean of Students here at MSU, one thing I know, the MSU experience is special. It's different. And for any of you parents who didn't go to school here, I got to tell you, what we do in Bozeman, what we do at Montana State University is special. And to be able to do that well, to do that at the best of our ability, we want to offer this experience in person, face-to-face, in our labs and in our classrooms, with all the measures we have in place to ensure our safety. Now, as campus has changed, so have our community expectations. I want to talk a little bit today about those expectations, what we expect of our campus community. And again, these expectations are not just for our students. They're for all of our employees and all of our guests that come to campus. You've heard a lot today about wearing masks, the requirement. And I'll tell you, wearing masks is a challenge. I'm up here in front of you today and trying to speak to you through this mask. It is not easy. There is a burden that comes with wearing a mask, and your professors this year are going to be sharing that burden. It's difficult, but it's a burden we've all agreed to, because not only is it a mandate from our governor, not only is it a requirement of our campus, it's one of the most important things we can do to ensure the safety of our students and our employees. We're going to ask you to social distance. We're going to ask you, if you feel sick, as Dr. Mitchell mentioned, if you feel sick, to stay at home and to work with your professors, who are, by the way, going to be very willing to work with you to ensure that you don't fall behind by staying at home in case you are sick. We're going to need your help. We're going to need your patience. We're going to need your generosity. And frankly, we're going to need your kindness. We're going to need to be our best selves this fall to ensure that we can continue to offer a face-to-face experience and to do what we do best, again, here in Bozeman. We're going to ask our students not to be enforcers. Sometimes it might happen. A student might be seen on campus not wearing a mask, and we're not going to ask our students to be enforcers. We are going to ask our students to be partners. We're going to ask our students to lead by example and to continue to do the right things, to social distance and to wear masks, to practice good hand hygiene, to ensure, again, that safety is maintained and continued. Now, that said, the university does have a university code of conduct. Our students know one of the things that they've done by agreeing to come to school is to abide by the university's rules. The code of conduct is there in case students violate our policies or our rules. And some of you have heard me talk, some of you at length, about what the university's conduct code says. Now, we don't expect to have to use the university's conduct code to enforce all the guidelines regarding COVID-19. But it is there, and it is an option in case we see a student who willfully denies or does not comply with the university's directives. To make sure that you know, if you're a new student and you're not aware of what the code of conduct says, we have created a website just for you. And I do not see that. I do see that. Thank you, Max. I do see that link to the university's website that talks about the code of conduct. It's montana.edu/knowyourcode. And you can see it on the screen here today. That's our website that we have for you to make sure that you have access to get your questions answered about what the code of conduct really says. If you dig into that website, you'll understand the first step of the university's conduct process is really focused on education. We try to balance the needs of our students along with the needs of our community. It's important for you to understand that MSU's Code of Conduct, it applies to student behavior both on campus as well as off campus. And any type of university violation, non-compliance with wearing a mask would be considered one. We will start that conversation through the Code of Conduct in an educational way. We believe that our students learn, and especially when they learn through the conduct process. And we hope, in case there's ever a violation, that our students would understand how important it is to comply with all of our rules, but especially this fall, the rules about wearing masks and the other things associated with COVID-19 safety. The truth is, if a student ever violates our conduct code more than once, the consequences for those violations could increase, including up to removing the student from campus. We call that a university conduct suspension. My best guess is we won't have to do that this fall. I don't expect us having to use the conduct code to ensure compliance with wearing masks, but it is there as an option in case, again, we do not have compliance. I frankly don't expect to have a lot of non-compliance. Walking around campus so far, interacting with students, our students get it. They're wearing masks, and they're wearing masks in understanding that's something that they can do, again, to lead by example, but to help ensure that we can continue to be here in Bozeman and to enjoy this incredible face-to-face experience. We've also given important guidance to our fraternities and our sororities. Those groups have not only embraced that guidance, but they're actively putting that guidance into place. And I am encouraged so far with how our fraternities and sororities have responded to us raising the bar and expecting them too to lead by example and to be a part of the solutions we have to these challenges facing all of us with COVID-19. Now, every generation of college students has a challenge. You'll remember back, our grandparents, even some of our great-grandparents, faced incredible challenges in World War II. Some of our parents, when they went to college in the 60s and the 70s, it was then civil rights and the Vietnam War. My generation, our generation, one of the challenges we faced was 9/11. And now, your generation, the students today, the challenge you will face, and I know we will overcome, is the challenges included with COVID-19. Challenges, one thing when you look back on history, if you realize these challenges that we face throughout the history of our country, these challenges have made us stronger. They've brought us together. And by bringing us together, we've walked away better as communities. We need you. We need you, our students, and even our parents. If our parents are logged in today, I want to say thank you for taking the time to engage in this important webinar. You are an incredible part of our academic community, and we're going to need your partnership and, again, your patience throughout the fall semester to make sure that we can be successful. None of us expected to be here today experiencing the challenges with this pandemic, but I'll tell you, we've worked incredibly well. We've tapped the innovation and the creativity and the scholarship of our faculty. We've worked late nights to make sure that these protocols have been in place. And now we're here. We're about ready to open the school year. The time is now, and we really want you to get excited about these opportunities, even the challenges we have as we face the realities behind COVID. Now, one of the most important things we can do this fall is to continue our high level of communications about what we're doing, what the expectations are, and how we plan to work together. The university has developed a very important website about information, resources, and beyond to communicate to all of our members of our community about important updates about COVID-19 and beyond. You can find the university's COVID-19 website listed right off our homepage. In addition, if you are curious, the university has published a 60-page report. We call it our roadmap. It's our guiding document that is helping us navigate the challenges presented by COVID-19. And many of the questions you might have would be answered by visiting those websites and reviewing MSU's roadmap. Many of our campus offices have also developed COVID-19 specific websites to help ensure that information is being disseminated across campus to our students, our faculty, and even our parents at home. If you aren't finding what you need, don't worry. We're here. We're here to help. And there's lots of ways for you to communicate to us. Pick up the phone, give us a call, utilize our email, utilize our chat functions. For those parents who are on the webinar today, we will continue to email you anywhere 2 to 3 times a month to ensure that you have access to all the important information that's out there. I want to close by mentioning just something a bit more about our students. One of the things is I've walked away after 10 years of being at MSU, I've noticed just the caliber of student leaders we have. We have great students, but the student leadership we have at MSU is truly unprecedented. Just today, I spent the morning with Mike Vasquez, your student body president, as we went up to the M to do some routine maintenance. And when I asked Mike, what's the most important thing you can offer? How are you going to lead by example today? He said very clearly, he is going to demonstrate what it takes being engaged not only over social media, but every day on campus, encouraging our students, again, to comply with our rules, to listen and to learn, and to participate in this incredible university environment that we call MSU. If you need help navigating this environment, please do not hesitate to reach out to the Dean of Students Office or any member of the panel today. Thank you for your time.
Thank you, Matt. You know, I every time I listen to our Dean of Students speak, it makes me want to be a better person. He is so great. And I realize that his secret is that he gets to spend so much time with the students. Because Matt is absolutely right. Our students are incredible, and they just fill us with so much energy and enthusiasm. And it's what gets us all out of bed in the morning. It makes us want to do all these things to make sure we have a great semester this fall. So I can't thank Matt enough for that reminder, and also for talking about the importance of community. We really are all in this together. And while this pandemic really seems like a bummer on many levels, the fact remains that when our students come here this fall and they experience this, just the fact of going through this in this fall is going to be an incredible learning experience. And every challenge makes us stronger and teaches us something new about ourselves and about working together as a community. And while those challenges can be hard, we have tools. And so we're going to introduce now Betsy Asserson, who's the Director of Counseling and Psychological Services, who's going to really talk about something very important, which is tools you can use to make your way through this fall. Betsy?
Thanks, Tracy. Hello, everyone, and welcome. Welcome back to MSU if you're coming back to join us, and a special welcome to our new students. I just feel privileged to be here with this great group of colleagues, and I think it's probably evident from their comments that MSU really is a university that's committed to supporting our students and really creating a community that is conducive to that support. I think my presence here on this panel is part of that commitment to support and taking care of students and your whole well-being. So one of the things that stands out to me from what we've heard so far is what Dr. Mitchell was talking about with taking that physical self-assessment each day when you wake up in the morning. And as you're, wherever you are, at home or wherever you might be right now watching this, taking a moment to kind of check in with yourself and what it's been like to process all of the information you've heard. I'm imagining many of you joined today because you have questions, you have concerns, maybe you're scared or worried. So take that moment to check in with yourself emotionally. How are you doing as you hear all this information and you move towards these next steps of joining us on campus and all of the anticipation that you have? Matt alluded to this in his comments about what it's like on a university campus in the fall. I've been at MSU for 19 years, and truly the start of fall semester is almost magical. It's one of my favorite times of being on campus because of the enthusiasm, the hopefulness, the new beginnings, and just the energy that our students bring, which is contagious. All of us that work here feel that as well, and we get excited too. But this fall isn't like previous falls. It's not a normal situation. And I think it's okay for us to take that moment and recognize that it's okay if you're maybe not reacting normally. A lot has changed. And with change, oftentimes there comes opportunities for growth and opportunities for change and moving towards something better. But it also can bring stress, worry, and anxiety. When we moved to remote learning last spring, I think many of us had the hope that everything would be back to normal by fall. I know I certainly had that hope. It was hard to process and hard to know what things might look like. So as we continue to engage with this uncertainty and not knowing what everything will be like, I think it's important to recognize that anxiety and stress might come along with that as you anticipate what things might look like. So what are some of the concerns that we know college students have? As you're returning to campus and anticipating what that might be like, here are some common concerns that we know students might be experiencing. All of us have concerns. I think it would be unusual for us to not have concerns when we're dealing with a pandemic that we're dealing with as a world, really. But we know for college students, one of the things they're really worried about is safety. And some of that is safety for their own well-being, but for a lot of students, it's safety concerns for their loved ones. What happens if someone that they know or care about gets sick? What if they're far away from home and they can't be with them? What if it's an elderly grandparent and they can't go visit? So all of those kind of concerns are real, and people are dealing with those, and that's something that you carry with you as you come to campus and move throughout your day. We also know that security is another area of concern for many people, and for college students, that's related to things about financial concerns, educational concerns, and security about that. What might it look like? Hopefully, some of the information you got today from my colleagues really helps to give you the best information that we have for right now about what that can look like here. But we recognize that those concerns are real for students too. Also, for some students, concerns about mental health care and accessing care. I'm going to talk later a little bit about the services we provide at Counseling and Psychological Services, but we know that students might be worrying about accessing support and getting treatment if they need it. And then lastly, how long might this last? I think many of us have asked that question to ourselves, to our family members, our friends, like, when will this end? And what we know is that we're all working on this together, and we don't have an end date, right? But we do know it's a moment in time. It won't last forever. As Matt recounted things that have happened throughout history, we know those things ended. So we know it will end, and helping us to remember that it's scary right now, but we know that it won't last forever, and that's important for us to hold on to as well. And then finally, I would say that the impact of social distancing is one that is also pretty real. And we've talked about all the ways we can work with that, but I think it's important to remember that we can be socially distant and not disconnected. So hopefully one of the take-home messages you've gotten today is we're working hard to find lots of ways for us to connect as a community, to support each other, so we can continue with the public health recommendations related to social distancing, but still focus on connecting and supporting each other. So all of those concerns I'm talking about, I think really, maybe that's increasing your anxiety or worry as we're talking, but one of the things I think we can really attend to is, one way of coping with that is to be gentle. How can we be gentle with ourselves and gentle with each other? So sometimes when people feel worried or anxious, they find themselves looking for things to control. And one of the things we can control is how we treat each other, even when we're under stress, even when our emotional reserves might be low, that taking that step towards kindness and being gentle is key. And then recognizing college is stressful even without a pandemic. So we know that students sometimes are hardest on themselves. And so really taking that moment to reflect on how you can be gentle with yourself and acknowledge that you're going through a lot as you make this transition back to campus, and that's okay, and giving yourself a little space to be gentle. What are some other things that you can do to help manage through the anxiety and the worry of what's going on currently? I think one of the big things we talk about is being informed, and that's really one of the goals today. As a university, we're going to work hard to continue to keep people informed and share information about public health recommendations and how we're responding. Many of us are inundated with media, and what we know is that sometimes that can increase worry and anxiety as well. So be informed with the facts, but also give yourself that space to step back and take a break. Do something that's grounding for you, that brings you joy, that helps you feel like you're taking care of yourself. We've talked a lot about connection and community, and so we'd really encourage people to look for those ways that you can connect with each other. Your professors, your residence life staff, other students, people in the residence halls, all of those people are here to help build that community. Our Office of Student Engagement has so many creative ways, similar to what Jeff was alluding to, creative ways for students to connect during this time. And so that will be really important as something that you can do is to build those connections. And then lastly, I'll make the point about kind of getting back to the basics. Maintaining your self-care routine. Sometimes when we get stressed or there's a lot going on, I know I find this to be true for myself too, is that some of the things that I know are most important are the first things to go. And really intentionally for us all to be thinking about, how do I take care of myself? How am I making sure I get enough sleep? I'm eating well, I'm drinking enough water, I'm getting exercise, and I'm staying socially connected and checking in with my emotional health. Those are all hugely important as we anticipate returning to fall. And then I wanted to share a little bit with you about counseling and psychological services. We're the on-campus mental health clinic. We're a part of University Health Partners. And we're staffed with a team of counselors and psychologists who have dedicated their professional careers really to working with college students and providing mental health services to them. One thing that we know is that many things don't look the same as when some of you maybe left campus in the spring, but our office remains open, but one of the changes we've made is we're providing telemental health appointments. So we are still available to provide those services to students, and actually we really encourage you to reach out and call us and make an appointment if you find that you're struggling in some ways. We want to be here to support you and help you get connected to the services that you need. We recognize that it can be hard sometimes if you're living, especially in a residence hall or off campus with roommates, that maybe there isn't a private space for you to engage in counseling. And that's an important piece to engaging in counseling. So we have some private rooms available within our offices that students can schedule in order to engage in a telemental health appointment. So again, just call our office and we can help get that set up. And then lastly, I would say that we continued all of our other ongoing services as well, but one that I want to highlight is our Let's Talk drop-in option. So for many students, they're not quite sure, do I want to actually start counseling? Maybe I just want to run this by a counselor and get some input or consultation. Our Let's Talk program is one where students can just drop in virtually and talk with a counselor briefly and not initiate full-on counseling, but just get that input and that support in that type of setting. So I encourage you to look at our website, and all of that information is highlighted there, as well as many more tips and self-care ideas that I think you might find helpful. So lastly, I just want to come back to the idea of that we've learned a lot throughout this pandemic, and there's much more for us to learn as we all come back together as a community. But I have to say for myself, I'm ready. I'm ready for the community to be back, and I'm ready to have those opportunities to engage with each of you. I have been touched, and I just have admired so many students and colleagues and people who have stepped into this moment and found ways to support each other, to really care for each other, and to demonstrate our resilience. I think that's one of the strengths that we all have as a Bobcat community here at MSU. I'm excited to meet you and can't wait to see you back on campus, and know that all of us here at MSU are eager to support you and help you through this transition. So thank you.
Thank you, Betsy. That was wonderful. So Betsy was our last speaker. I'm going to make a few remarks and then we'll wind up. But I am going to make sure that I am doing what we want you all to do when you come to campus. So first, I would like to thank our panelists again. Dr. Sam Mitchell, the Chief Medical Officer for University Health Partners. Beth Burroughs, the head of the Department of Mathematical Sciences. Jeff Bondy, the Director of Residence Life. Matt Caires, the Dean of Students. And of course, Betsy Asserson, the Director of Counseling and Psychological Services. And you can see on your screen right now their contact information. And please remember that if you go to the MSU homepage and you scroll down just a tiny bit, you'll see the link to our COVID-19 page. That page has got a ton of information on it, and it also has an ability for you to submit an email question to the university. We just want to remind you that we really are all in this together. We're in this together in the classroom. We're going to be in this together after hours off campus, which is we need to all be working together to make this successful. And we know that our students are up for it. This really is an incredible challenge, but it's also a moment of incredible learning. And I think when this is all over, we're going to look back at this and be proud of ourselves about how we came together and made this academic year an incredible success. We're so looking forward to the students coming here this fall. You fill us with so much hope and energy, and we can't wait to have you. Thank you for joining us this afternoon, and best wishes to all of you. Go Cats!